Scholar at Johns Hopkins University Center for Health Security. Thank you for joining me on this Christmas Day, Dr. Adalja. Merry Christmas. I'm sure, as you know, millions of families have begun gathering despite, the surging COVID cases. And again, President Biden said, look, if you're vaccinated and boosted, you don't have to cancel your holiday plans. What's your message to those families today who are together? How can we continue to be safe?
I would tell those families that are together now to enjoy the day, especially if they're vaccinated, because they're free from the threat that COVID-19 can cause severe disease, hospitalization, or death in any of them or the people they're gathering with. We're on two different kind of tracks here with the vaccinated and the high-risk unvaccinated. And I think it's important for the vaccinated to be able to enjoy their life, because this isn't something that's going to go away. And I think that the way to make COVID-19 risk stratification and risk calculation easier is to be vaccinated. And I think that's the message that we need. It's not March 2020. We've got tests, we've got antivirals, we've got monoclonal antibodies, we've got vaccines. So it's a very different place than just a year ago.
Yeah, a very different place than just a year ago. That is the optimistic part of this conversation, right? You saw Arnadia Romero there at the airport in Atlanta. There's been a lot of back and forth about traveling and whether or not it's safe. I know that a lot of these new airplanes have these HEPA filtration systems that I think they filter out about 99.9% of particles. What is your take on that? Getting on an airplane, how safe is it? Is there a safe way to do it? And should little children who cannot be vaccinated get on these planes?
Planes tend to be relatively safe because of the fact that they've got the filtration that you just mentioned, and most people are going to be wearing masks on the plane except for very small children. So I think this is a manageable risk. We've not seen transmission on planes since these requirements have been put into place and this upgrade in filtration. I think that it's more about what you do at the airport or what you do when you get to your destination. That's the risk with travel. But again, for a fully vaccinated individual, I think it's something that's a very manageable risk. And for low-risk children who are not vaccinated, so long as they don't have any medical problems, I think it's a safe thing. And the fact is, everybody wearing masks keeps those people that can't be vaccinated, like small children below the age of 5, safe as well.
Yeah, one step that I take too is when I'm on an airplane, I don't eat the snacks or drink when it's being served. I kind of wait till everyone's done, and then I, will munch on whatever I have. So, the CDC director, Dr. Rochelle Walensky, said this week that safety for holiday gatherings has less to do with the journey there. I think you were mentioning this, but more to do with behaviors the week leading up, the week before. Do people need to keep that in mind, when they're heading home after the holidays, given the surge?
Yeah, you definitely have to think about, could I have been exposed to COVID-19? Do I need to get a test? Do I have any symptoms that could be consistent with COVID-19? And hopefully rapid tests will become more plentiful or easier to find in the days to come, and they'll be able to test themselves if they just want that peace of mind. But again, for the fully vaccinated, I think you've got to expect that you're going to get exposed to Omicron. This variant can infect, but the fact is we have to focus much more on severity of illness. And in the vaccinated, it is something that is not very severe, more like the common cold. And I think that two-track pandemic is how you kind of have to think about how safe your activities are or unsafe they are.
Yeah, and so on that note, I mean, it's important to point out that hospitalizations and deaths are not at the peak levels that we saw right at the peak of the pandemic. And you're talking about these new early studies that suggest Omicron may be less likely to cause severe disease and hospitalization compared to the Delta variant. So the fact that these hospitalizations are not, where it was, during the peak of the pandemic, does that tell us, is that evidence that, yes, this variant is not as severe, does not cause as severe illness, or is it just too soon to tell when you look at the hospitalization rates?
It's too soon to tell. We know that the data coming out of South Africa, the data coming out of Scotland, places like that show that this tends to hospitalize less than Delta does. But the fact is this can still kill people. We know people have died in the United States from Omicron. But the fact that hospitalizations aren't up may be an indicator that a lot of these cases are mild. A lot of them might be occurring in fully vaccinated individuals. We'll have to wait and see. But many hospitals are already pushed to the brink with Delta patients. And now they're going to get even a little bit of Omicron could actually be something that puts them over the brink in certain regions of this country. So I think we still have to be very touch and go with the way hospital capacity looks in the regional level. Systemically, yes, I think we're in a better place, but regions may be hit hard.
Yeah, and because of the concerns of overwhelming hospitals with Omicron, and of course, that also impacting hospital or healthcare worker shortages. The CDC released updated guidance for healthcare workers, right, who test positive for COVID, saying that they can return to work after 7 days as opposed to 10 if they are asymptomatic and test negative. But it's not going to be available to the general public, these guidelines. Do you think that they should be extended to the general public?
Definitely. We have data that shows that people don't really fit into that one-size-fits-all 10-day isolation period. And we have rapid tests, if you can find them, that can help us gauge when somebody becomes no longer contagious. And then we can kind of precision guide isolation periods. And I think this is something that should apply not only to healthcare workers, but to everybody, because we have the data to do so. Because even if these breakthrough infections are mild, the fact that people have to isolate for 10 days, that's very disruptive to people's lives. And if we're going to get to that post-pandemic world, I think we've got to use the science to precision guide isolation periods to minimize the disruptions that these mild cases are going to cause.
Yeah, fair enough. Great point. Dr. Amish Adalja, thank you so much for joining me on this Christmas. Happy holidays to you.
You too. Thank you.
All right. Up next, shocking new video of the January 6th riot showing a violent 3-hour battle in the Capitol.